All right. Hello. Good morning. Good afternoon. Good evening. Yes. So this is the last video that I will be giving for histopathology. And for this video, I will be discussing about exfoliative cytology. Okay. So yes, I hope you can still remember the process of exfoliation from your histology or probably from your anatomy and physiology, okay, because it plays a part, or yeah, it's something that we have discussed already in the past, okay, in your other subjects. All right, so that yes, you would be able to understand your exfoliative cytology. Okay, so what is exfoliative cytology? So this is the branch of medicine that deals with the study of cells that are exfoliated or scraped off from the lining epithelium and the mucosa of different organs. So remember, if we go back, or if we try to recall our knowledge when it comes to your epithelium or your epithelial tissue. So one characteristic of your epithelial tissue is that it is capable of renewing itself. Okay, so how does the renewal of your epithelial tissue take place, or yes, take place? So it is via your exfoliation. Okay, so it is but a normal, or it is a normal process that takes place inside the body. And these exfoliated cells, so they may become part of the fluid of your body. They may become part of your body fluids. Thus, we are able to yes, we are able to examine them in exfoliative cytology. So from the term itself, exfoliative, we are concerned about the exfoliated cells, which are present, okay, in your sample. Cytology, primarily because, okay, your cells, they are already present there as cells, okay, as merely your cells and not as part of your tissue anymore. Okay, yes. So that's the term exfoliative cytology. All right. So when we say exfoliative cytology, yes. So this, you would be able to see, okay, the cells that have been exfoliated or desquamated from your epithelial cells. So like for example, so we have here an epithelial lining, okay, and of course, these cells which are part of your epithelial lining, so they will be desquamated or exfoliated. So thus they become part of your fluids or of any body sample for that matter. All right. And under the microscope, you would be able to see just your cells. Okay, your desquamated cells, just like for this particular image. So you can see there a lot of squamous epithelial cells that have been desquamated from your epithelial surface. Right? So there are two divisions of exfoliative cytology. So just like when we discussed, or when we had our introductory discussion on histopathology or histotechniques, okay, I also mentioned two divisions, and actually they are somewhat similar to one another. The only difference is that for exfoliative cytology, so our concern are the cells themselves. Okay, yes, are the cells. So one is your cytopathology, that is one division. So from the term itself, cytopathology. Okay, so this is the study of abnormal cells. Okay, so abnormal cells which are correlated to the presence of a particular pathology or a particular disease or disorder. All right, and then the other one is your cytotechnique. So again, just like for your histotechnique, our concern here is for us to have the knowledge and the skills regarding the different methods in preparing your samples, in this case your cells, for microscopic examination. Okay, so in the laboratory, we are concerned about, as medical technologists, we are concerned about your cytotechnique. because we are the ones who prepare the different smears for examination, for microscopic examination. Okay, and again, for your cytopathology, so that is the concern of your pathologist. All right. Yes, so under your diagnostic cytology, so these are the different applications, okay, of your exfoliative cytology in the clinical setting. Okay, so primarily it is utilized for the diagnosis of cancer. Okay, because your cancer cells, they are actually demonstrable in the different fluids that we have. Okay, so they are often part, okay, of the desquamated cells which are present in our fluids. All right. Another, it is also utilized for the differentiation between your malignant and your benign tumors. Okay. Yeah. So depending, of course, on the type of cells that we see or that your pathologist sees, okay, during microscopic examination, then we would be able to, from that, we would be able to differentiate a tumor, okay, on whether it is a malignant one or a benign one, right? Yes. Apart from that, we can also differentiate tumors from other diseases. So it is utilized for, yes, for us to differentiate your malignancy, okay, or your tumors from other kinds of diseases. Like, for example, we have your infections, inflammations, or even degenerative diseases. And lastly, we use it as an assessment or for the evaluation of hormonal status of an individual. Particularly, okay, we are concerned about the fertility conditions among males and females. So actually, um, if you are going to compare it, the yes, the kind of examination that we perform in the laboratory is more on females. Okay, more on females po when it comes to the hormonal status. Okay. And then lastly, okay, last application of your diagnostic exfoliative cytology is in the determination of the true sex of an individual. So what is your true sex? Are you really a male? Are you really a female? Okay, ayan. So we have your diagnostic exfoliative cytology. Okay, so since if you're going to look at the applications of your exfoliative cytology, much of it is concerned about your cancer or your malignancy, okay? And so what are the different criteria that we use in order for us to be able to classify your cells as cancer cells or malignant cells, okay? So when we say cancer, this is synonymous to the term malignancy. And we all know that when it comes to your malignant cells, their difference with that of your normal cells is that your malignant cells are markedly undifferentiated. Okay? So that means they remain to be immature cells. All right? And so, what are some of the abnormalities that we are able to see in your undifferentiated or immature cells, which are indicative of cancer? So number one, we have pleomorphism. Okay, so when we say pleo, so pleo refers to many or varied. Okay, and then morphism refers to the morphology of your cells. So in short, okay, to simply put it, so there is a varied morphology among your cells. So what morphological variations are we able to see? So there is a variation in size, okay, in shape, in the form of your cells, and in the appearance of your cells. So in particular, your cells will appear undifferentiated or immature during microscopic diagnosis. Okay, another, there is hyperchromatism. So from the term itself, hyper, there is an increased, okay, in the staining characteristic, particularly of your nuclear structures, di ba? From the term itself, chromatism. So where can you see your chromatin? So remember that your chromatin, they are part of your nucleus. Okay? And so what part of the cell is greatly affected in hyperchromatism? So you would be able to see it in your nucleus. Okay, so there is an increase in the staining affinity above the normal. Okay, that's why it is hyper, affecting mainly the nuclear structures. Okay, thus the term chromatism. Okay, yes, so in contrast to the vesicular staining of your cytoplasm. So parang when we say vesicular staining, parang hindi siya homogeneous. So there seems to be vesicles in the cytoplasm. Okay, yes, ayan. All right, so another criteria is that your cells also, yes, your cells also exhibit multinucleation. Okay, so this pertains to the increase in the number of nuclei of your cells. All right, and then another one, you would be able to observe a typical mitotic figure. So that means when you see it under the microscope, you would actually be able to note that your cells are abnormally proliferating. Okay, so why? Because of the presence of your atypical mitotic figures. Okay, so this would involve the presence of abnormal stages, okay, abnormal mitotic stages in your cells. And then lastly, reversal of the nucleocytoplasmic ratio. Remember that for mature cells, the nucleocytoplasmic ratio should be low. Diba? Because the nucleus of your cells, so they become smaller as your cell matures. Right? Yes. If you can still remember hematopoiesis. Okay. Ayan. So normally, your nucleocytoplasmic ratio should decrease because the proportion of your nucleus in reference to your cell size decreases. In contrast, the proportion of your cytoplasm in relation to your cell size increases, right? Thus, the nucleocytoplasmic ratio should be low. Okay, when the cell is already mature or as the cell matures. All right. So in order for you to understand better this different criteria, okay, yes, so you would be able to see here your pleomorphism. Okay, so as you can see, there are a lot of varying sizes, shapes, and appearance of your cells, right? So this is one cell, and then it appears like this. Okay, some would appear like this, rather. All right. So as you can see here, there is pleomorphism. There are many sizes and shapes. Okay, so your cells exhibit variation in sizes and shapes. Okay, so pleomorphism. So another, we have here a hyperchromatic staining. So like for example, this one. So as you can see, the cytoplasm does not stain homogeneously. Okay, so there seems to be vesicles in your cytoplasm. Okay, ayan. So some areas are dark, some areas are are lighter than usual. And one very important or noticeable characteristic is that your nuclei, the nuclei of your cells, stain very dark. Okay, yan. So you have here hyperchromatic nuclei. It takes up so much, okay, too much of your stain. Thus, they become darkly stained. Okay, so these are your hyperchromatic nuclei. Okay, and we also have here some atypical mitotic figures, like for example, this one. Okay, ayan. So you have here cells that are undergoing mitosis, which actually should not be the case. Diba? It should not be the case. Okay, so we have here, yes, large numbers of malignant cells that are undergoing mitosis. Okay, yes, all right. And then we have here high nucleocytoplasmic ratio as okay, as shown by the very large nuclei of your cells. Yes, so remember that I mentioned when it comes to your nucleocytoplasmic ratio, it should be low in mature cells. Okay, yes. And your high cytoplasmic ratio, this is actually observable in your undifferentiated or immature cells, which is the case in your malignancy or in your cancer. Okay? All right, ayan. So we have here malignant cells present in your body fluids. So as you can see, they have very large nucleus. Okay, very large nucleus. They also exhibit pleomorphism because of the differences in the cell shape and the cell size. Okay, ayan. So that's why your exfoliative cytology is capable of or is utilized rather in the detection of malignancy, because malignant cells, if they are present in your organs, say for example, they are usually demonstrable in whatever fluid that surrounds your organ. Like for example, for lung cancer, okay? So for lung cancer, the fluid that we can evaluate, okay, in order to detect its presence would be your pleural fluid. Okay, ayan. All right. So criteria for the identification of your abnormal cells. So how would we know that a particular cell is abnormal? Okay, so we have here some of the changes which are seen in the cell membrane of your abnormal cells. Okay, so of course, if a particular cell is abnormal, okay, so this will result to a variation in the size, in the shape, or even in the form of your cell. Okay, ayan. So this is attributable to changes in the cell membrane. Okay, so there might be enlargement of your cells. They might also there might also be a diminution in the size of your cells. So and your cells become bigger, okay, or your cells become smaller. Okay, thus creating now a variation in the sizes of your cell. So apart from that, another change in the cell membrane would be the presence of an indistinctness in the cellular boundary. So you would not be able to tell which one or which is the cell membrane or the cell boundary of your cells. Okay, which one is the boundary of your cells, which one is the membrane that should have enclosed your cell, especially if they are present in aggregates or in clumps. Okay, yes, it's difficult for us to observe the cell membrane. Okay, yes, the cell membrane of your cells. All right, changes in the cytoplasm. So, the presence of high numbers of your cytoplasmic inclusions. Okay, so I hope you can still remember the different types of cytoplasmic inclusions. So, examples of cytoplasmic inclusions that we have your pigment granules. Okay, so in abnormal cells, they are usually increased. What else? Presence of vacuoles, okay, which also serves as an inclusion body. Okay, presence of vesicles that contain secretions. Okay, so those are examples of your cytoplasmic inclusions, and they tend to be present in high numbers, okay, in abnormal cells. Right? Yes. So another change in the cytoplasm is the disintegration of your cytoplasmic organelles. So of course, since the presence of your cells is brought about by an abnormal proliferation, so the different organelles, okay, the different organelles, they are more susceptible to damage or disintegration, okay, brought about by the abnormal proliferation of your cells. Of course, if the proliferation is abnormal, then do not expect to produce normal cells. Okay, so as a consequence of abnormal proliferation, the cells that you are going to produce are, of course, abnormal also. Okay, and one of the abnormality that we can see is that the cytoplasmic organelles, they are very susceptible to damage. That's why they undergo disintegration. Okay, and another, in addition to your disintegration, so dissolution of your cytoplasmic components can also happen. Because again, okay, because again, your cell is abnormal. Okay, and so does the parts also. All right, so you don't expect your structures or your components to be normal. Alright, so they do not just disintegrate, they can also undergo dissolution. Ayan, so they are broken down. Ayan, because they are abnormal. Alright, so changes in the nucleus, pycnosis. Okay, remember that when we say pycnosis, di ba, from your hematology 1, so pycnosis, so this is characterized by a condensed chromatin or condensed nucleus, di ba? As in, the chromatin fibers are packed. Oh, they are packed. They are condensed. Ayan. And pycnotic nucleus, this is a characteristic of abnormal cells. Okay, so there is condensation of your chromatin materials. Okay, so in addition to your pycnosis, karyohexis and karyolysis may also take place. So when we say karyohexis, so this pertains to the breakdown of your nuclear components. Karyolysis, on the other hand, refers to the dissolution of your nuclear components. Okay, such as what happens also in the cytoplasmic structures of your cell. So there is breaking, there is disintegration, and there is dissolution. So same is true with your nuclear structure. So there is disintegration or karyohexis. There is also dissolution or karyolysis. Okay? Ayan. Right? Ayan. So again, those are the criteria of your abnormal cells. So this is an image. Okay, an image an image of your herpes pala, sorry. Herpes simplex virus infection. Yes, ayan. So remember, parang ano to, parang misplaced ito. Okay, siguro nakalimutan ko siyang itaas. Ayan, so this is one of the applications of your exfoliative cytology. So we can differentiate cancer from your infectious or your infections. Okay? So how do we report? Ayan. This is the reporting of your pap smear in relation to malignancy. Okay? So actually, this manner of reporting is not utilized anymore. Okay? It is an absolute obsolete. Okay? This is an obsolete manner of reporting. But the problem is this one is still being asked in the board exam. And so we also try to include it in our discussion. Okay, so you have to memorize this table because sometimes they would ask two questions in the board exam coming from this table. Okay, yeah, so how do we report it? So we have here 5 classes, class 1, 2, 3, 4, and 5. So depending upon, okay, the morphology of cells that you are able or that the pathologist is able to observe during microscopic examination. Okay, so class 1, so absence of atypical or abnormal cells, okay, in the sample. So class 2, atypical cytologic structure, picture but no evidence of malignancy. And then class 3, we have cytologic picture suggestive but not conclusive of malignancy. And then class 4, cytologic picture strongly suggestive of malignancy. And then class 5, cytologic picture that is conclusive of malignancy. Okay, so kindly memorize this table because you will be using it not just for our quiz and our exam, but also during your internship. Okay, yes, and most importantly, during your board exam. Right? Ayan. So another important application of your exfoliative cytology is in determining the hormonal status of a female. So just like what I have emphasized a while back, for exfoliative cytology, it's more on female fertility. Okay, yes. You would be able to encounter also assessment of male fertility, okay, during your clinical microscopy subject. Yes, I think probably next semester. Okay, yes. But for exfoliative cytology, it's more on it's more on female fertility. So particularly, we are evaluating the hormonal status of a female, okay, via, of course, your vaginal hormonal cytology. Right? So for sex determination, so ito na siya. So do you want to know if you are a male, really a male or a female? So in exfoliative cytology, okay, in exfoliative cytology, we are able to determine that. And the specimens that are utilized for sex determination are the following. We have scrapings from the buccal cavity. So dito, okay, scrapings from your buccal cavity. Siyempre sa loob, besh. Okay. Alright. And then we also have scrapings from the vaginal mucosa of our female patients. Okay. So true sex, this is determined by the presence of bar bodies. Yes, so true sex is determined by the presence of your bar bodies, which are seen in the inner aspect or inner portion of your nuclear membrane. So sex determination in exfoliative cytology, this is an important method in the field of genetics. Okay, actually hindi siya masyadong kita. Yan. So bar bodies, they are only exhibited by females because of the presence of the 2X chromosomes. Okay, because of the presence of the 2X, diba? Your sex chromosomes, X or Y, X and Y for males, and then for females, we have 2X's. Tama? So we have 2X's, all right? 2X chromosomes. Okay? So exfoliative cytology, this is, yes, these are rather your mature superficial cells. Okay, so they have an acidophilic character, depending upon the predominant hormone that is present in our female. So later we would be able to discuss that in detail when we go to the different cells. So this naman, we have here, there, the small one there. So that's your bar body. So again, this is exhibited by females. Okay, yeah. So if you want to know if you are really a female, then your cells should be able to exhibit your bar body. Otherwise, ayan. Okay. Okay. Otherwise, yeah, questionable ang pagiging female mo. Okay, so females again exhibit your bar body because of the presence of the two X chromosomes. Okay, so what are the different samples that we can use for exfoliative cytology? So number one, we have scrapings and aspirates. Okay, so of course, showing now, or these scrapings rather and aspirates, okay, so they are collected from the lining epithelium or from the mucosa of the reproductive, female reproductive tract. Okay, such as in the case of your vagina, from your cervix, or even from your endometrium. So, I think in my, tama ba ako? Wala kasi dito. But in the module, you actually have there, okay, the different equipment, okay, the different equipment as well as the different type of samples that we can collect from the female reproductive tract. So kindly read on that part. Okay? Yes. So another sample that we can collect for exfoliative cytology, we have your prostatic secretions. So this is the secretions are, or your prostate gland rather, so it is stimulated to release its secretions by performing or after performing a prostatic massage. Okay, so how do we perform your prostatic massage? So this is via the intrarectal route using the middle and index finger. So syempre, ipapasok mo yung kamay mo doon. Okay, and then you're going to, ganun talaga, you're going to massage the prostate so that the secretions in the prostate gland will be released. Okay, and that is the one that you are going to collect for exfoliative cytology. All right, so another, we also have your bronchial secretions or sputum. So for our sputum in particular, we want to have or to collect a deep cuff specimen. Okay, so that your specimen or sample is representative of your lower respiratory tract. Okay, ayan. So another, we can also perform bronchoscopic aspiration, especially in patients who are having some trouble producing a deep cough. Okay, yeah. So we don't want it to be contaminated with cellular elements which are found in the upper respiratory tract. So it has to be representative of your lower respiratory tract. Right. Another, we also have your gastric contents and duodenal fluid. So this is usually obtained via your intubation technique. Okay. So we are going to insert a nasogastric tube, yan, from the nose, okay, and into the stomach. Okay. So the type or the name of this tube is your Levine tube. Okay, so we have your Levine tube. This is a tube that is inserted through the nose. Okay, the other one is your Refus tube. So this one naman is a tube that is inserted via the mouth. Okay, so it's not just your nasogastric tube, but it could also be, or it's not just through the nose, but it could also be inserted through the mouth. Okay, so these are your intubation techniques. Okay, so through the nose, we have your Levine. Okay, and then through the mouth, we have your, okay, so through the mouth, we have your Refus, okay, Refus tube. All right, so gastric contents are drained. Okay, yes, and um, it would contain water. Okay, of course, your acid in the form of hydrochloric acid with food debris. All right. So prior to the collection of your gastric contents, yes, so the patient is actually asked to fast. Okay, so there is a fasting requirement prior to the collection of your gastric contents. Okay, so your duodenal fluid, on the other hand, will appear greenish yellow, and it is alkaline as compared to the acidic pH of your gastric fluid, and it is mucoid as compared to the watery consistency of your gastric fluid. Okay. So another specimen that we can perform, we have your CSF, your cerebrospinal fluid. So the most common method of collection for your CSF is your lumbar tap. Okay, so actually magkakaiba ang naka-specify when it comes to the performance of your lumbar tap. So if it is asked in histopathology, so we collect it between the second and third lumbar vertebrae using a long needle, which we refer to as your Silverman needle. So if, for example, this will be asked naman in your clinical microscopy, so in clinical microscopy, we collect it from the third and fourth or the fourth and fifth vertebrae, okay, lumbar vertebrae. But since our subject is histopathology, so take note that it is collected from the second and third lumbar vertebrae. Okay. Right. So another, we also have your pleural fluid. Okay, so the different fluids from your cavities. We have your pleural fluid, we have your pericardial fluid, and your peritoneal fluid. Okay, so your pleural fluid, this is obtained via your thoracocentesis. Your pericardial fluid is obtained via your pericardiocentesis, and then your peritoneal fluid is obtained via your paracentesis. Okay, so depending upon the organ in question, we can collect pleural fluid if it is your lungs, pericardial fluid if it is your heart, and of course, the other internal organs if it is your peritoneal fluid. Okay, so another, we can also process bone marrow. Okay, bone marrow aspirations, urine also, and lastly, we have your skin scrapings. Okay, so there are instances wherein the type of sample that we are going to collect only has very low amounts of cells. Okay, so actually in most of the fluids that we collect from, or that are collected from our patients, yes, they usually contain just your cells. Thus, they are referred to as your cell suspensions. Okay, so for cell suspensions, the required volume which has to be collected is 20 to 30 ml. So that, of course, this will increase the probability that you are really able to collect abnormal cells if they are present in your fluids. Okay, so again, for cell suspensions, the required amount is 20 to 30 ml. Okay, so since these cell suspensions usually contain a lot of fluid but a few of your cells, there is a need for us to perform your cytospin centrifugation. Okay, yes. So what is the purpose of cytospin centrifugation? So this serves to concentrate, okay? This serves to concentrate the different cells which are found in your sample. So the required, okay, the required centrifugation is 2000 RPM. Okay, 2000 RPM. All right, yes. As for the anticoagulant, okay, yes, especially if we are going to collect your pleural fluid. So for pleural fluid, for peritoneal, okay, so for peritoneal fluid, and then lastly for your pericardial fluid, there is a need for us to add an anticoagulant in the form of your heparin. So what is the required amount of heparin? So we have 300 rather units of heparin, okay, for every 100 ml of aspirate. Okay, so I repeat, there is a need for you to add an anticoagulant. So in particular, we make use of 300 unit of heparin per 100 ml of aspirate. So the purpose of your heparin is to prevent the formation of your jelly-like clots. Okay, so to prevent the formation of your jelly-like clots. All right, so after preparing your specimen, the next thing that you have to do is, of course, to make your smears. Okay, so these are the same kind of methods that were discussed to you during the introductory part, right? So kindly review also how we prepare your smears. Okay, yes, we have here your touch prep, spreading, streaking, pull apart, and your teasing. So these are the different methods that we perform to prepare your cytologic smears. All right. Yan. So in some instances or in some kinds of specimens, okay, so there is a need for us to make use of your adhesives. So we have to perform adhesion in order to prevent the washing out or washing off of your smears, especially during the processing. Okay, particularly we are concerned about the washing out of your smears during staining. So in order to make sure or to ensure that your smears are properly adhere on your glass slides, then we should perform your adhesion step. Okay, so what are the different specimens which would require adhesion? So number one, we have your urinary sediments, your bronchial lavage specimen, okay, and specimens that utilize proteolytic enzymes during processing. Why? Because again, mawawash out yan. So they will be washed out especially during staining if you do not perform your adhesion technique. Okay, so for adhesion technique, we can make use of the following adhesives. We have your pooled human serum or plasma. Okay, we can also make use of your celloidine ether alcohol and your leuconostoc culture. Okay, so these are the different adhesives for your smears. All right. Yes. So after you have already prepared your smears, the next thing that you have to do is to fix it. Okay, ayan. So smears, they have to be fixed immediately. Why? Because remember that your cells exist as cells lang, hindi siya part ng tissue. And so, since they exist as cells only, and not cells that are part of a tissue sample. So they tend to undergo disintegration, okay? Or they tend to undergo disintegration faster. Okay, so mas madali po silang nasisira in short. Ayan, yes, they are more susceptible to disintegration. And so you have to perform fixation immediately after preparation. Okay, so what are the different common fixatives? Actually, the one that is recommended is really your ethyl ether. However, yes, however, we all know that using ether in the laboratory is already being avoided. So as much as possible, we don't want to use ether in the laboratory because it's an explosive, diba? It's an explosive, it's a highly flammable substance, it's a highly volatile substance. So its use in the laboratory is being avoided already. Okay, and so the most commonly used fixatives among these common fixatives is your 95% ethyl alcohol. Okay, yan. So in addition to these two, we can also make use of your isopropyl alcohol with ethyl alcohol. We can also make use of your acetone, okay, with glycol, your carnoise fluid, belonoise fluid. We can also make use of your Saccomano's preservative or fixative. Okay, your Saccomano fixative or preservative. Right? So how do we yes, how do we fix your smear? So we can either place it or immerse it in a fixative solution, just like what we do in the preparation of your bud smears, right? So we just dip your smear there in order for it to be fixed. So another way by which we can fix your smear is by spraying it with your fixative. Okay, so in the laboratory, which one is more preferred? It's via spraying. Okay, yes, because there is a less likelihood that your smear will be washed out. Okay, less likelihood of your smear getting washed out by the fixative. So that's why, yes, we prefer the spraying method. Okay, so just like what I have mentioned, exfoliated cells decompose rapidly. Okay, and when your smears dry, so this will worsen, diba? This will worsen the decomposition of your cells. Okay, ayan. So that's why you have to fix it. You have to fix it ASAP, ASAP or immediately. Right? So again, so 95% ethyl alcohol, that is actually the best one, but yeah, we are trying to avoid the use of ether. So the most commonly used is your 95% ethanol. Okay, so now let us move on to your vaginal hormonal cytology. Okay? So for your vaginal hormonal cytology, so this may be performed regularly without undue risk. Why? Because although the procedure is invasive, it's not it's not as invasive as the other methods of collection for your samples. Okay, so yes, the sample for your vaginal hormonal cytology. So this is best taken from the upper lateral third of the vaginal wall, which is actually more accessible. And apart from that, it is less likely to be contaminated by cellular debris or vaginal discharges. Okay. Um, the reason why is because it's far enough. Okay, so if we are going to see or describe, okay, to describe the location of your upper lateral third of the vaginal wall, it's far enough that we are able to avoid contaminations, okay, brought about by your cellular debris which are usually present in the outer portions of your vaginal canal. And apart from that, okay, we are also able to avoid the presence of your vaginal discharges because it's far enough, but not too far that it becomes more invasive already. So you will not actually collect from the uterus, 'di ba? Hindi ka naman pupunta doon sa may uterus na part. Okay? Only from or only up to the upper lateral third of your vaginal wall. Okay? Yes. All right. More accessible because hindi mo naman siya ituturok hanggang sa lagpas ng cervix. Okay? Not until the cervix or not even until the uterus part. Okay, so that's why it is actually the preferred sample for your vaginal hormonal cytology. So what are the different cells that are seen in your vaginal smears? So the first one is your mature superficial cells. So they are characterized by the presence of your dark pyknotic nuclei and they exhibit true acidophilia. So when we say true acidophilia, so this is seen a as a result of estrogen influence. Okay? So, sabi natin dyan, acidophilia. So, your cells should be acidophilic. So, in short, they should have this appearance. So, again, true acidophilia. So this is under the influence or due to the influence of the hormone estrogen. So how would we know that the female has a lot of estrogen? So you should be able to see acidophilic mature superficial cells. Okay, so in particular, my other characteristics of your mature superficial cells. So they are basically your polygonal squamous epithelial cells. Okay, so since they are acidophilic, so they should have a pale pink staining cytoplasm, and you can see there that their characteristic pink pycnotic, dark pycnotic nuclei. Okay, so under your estrogen influence, right? So another cell that we are able to see are your intermediate cells. Okay, so your intermediate cells, they are medium-sized polyhedral or elongated cells with basophilic, okay, cytoplasm showing vacuoles. And so we have your navicular cells. So they are both shaped with the tendency to fold or curl on edges. And the presence of your navicular cells, so this is due to an estrogen, combined estrogen-progesterone effect, and it is seen in the latter half of your menstrual cycle and during pregnancy. So in addition to that, your navicular cells, they are also associated with menopause. Okay, with menopause. Okay, so another cell in your vaginal smear. So we have your pregnancy cells. Okay? Okay, yes. Ayan, medyo nagka-problema sa connection. All right, so again, we have here your intermediate cells. So there are two types. We have your navicular cells, which I think I have already discussed. And then the other type of intermediate cell is are your pregnancy cells. Okay, so your pregnancy cells, so they appear as round, oval, or boat-shaped cells with translucent basophilic cytoplasm, and it is usually this translucent characteristic that is seen in your pregnancy cells, this is greatest, okay, at the center due to the presence of your glycogen. Okay, so take note that your pregnancy cells, they are glycogen-containing cells. And apart from that, your pregnancy cells, in order to characterize it from your navicular cells, they have a double-walled boundary appearance. Okay, so we have here your intermediate cells. Okay, so we have here your intermediate cells. All right, so they are medium-sized as compared to the very large mature superficial cell that we see. So they may be polyhedral or elongated, and take note that their cytoplasm is basophilic. So the cytoplasm of your pregnancy cells, so it is usually translucent basophilic, and the translucent character is pronounced, okay, pronounced at the center of your cell. Okay, so the next kind of, or the next cell that we are able to see are your parabasal cells. So they are, in addition to your mature superficial cells, they are quite easily distinguished, okay, or observed in your vaginal smears because of their characteristic fried egg appearance, okay, your sunny side up appearance. So we have your parabasal cells. They are strongly basophilic, okay, and they usually have a large vesicular nucleus, and they are seen in the following. So we have 2 weeks of age, okay, to puberty after childbirth, abortions after menopause. Okay, so ganito ang itsura ng parabasal cells. So as you can see, they have a fried egg appearance. So in particular, what fried egg is that? So we have your sunny side up appearance. Okay, so we have your parabasal cells. So if you are going to compare its basophilic cytoplasm, it is more basophilic as compared to your intermediate cells. Okay, and they have a larger nucleus also as compared to your intermediate cells. Okay. So in addition to your parabasal cells, your endometrial cells may also be observed. So they are, okay, they are slightly cylindrical with less basophilic cytoplasm, and they are common during and 1 to 4 days after menstruation. So remember that during menstruation, what happens is the endometrium, right, of your uterus is being shed, okay, during your menstruation. And so of course it is understandable that your endometrial cells will also be seen during menstruation, and then 1 to 4 days after menstruation, because again, ano bang nangyayari pag nang-menstruate ka? Your endometrium is being shed. Okay, ayan. So that's why your endometrial cells are seen also during this time. All right, so that's your parabasal cells, round to oval shape with a small basophilic cytoplasm. They are smaller than your intermediate cells, and they have a larger, just like what I have mentioned, vesicular nucleus. Okay. So this is an additional, yes, this is an additional kind of cell that we can see, okay, in your vaginal smear. So we call them your endocervical cells. So basically, your endocervical cells, they are usually seen in large groups or in clusters. Okay, so they have a pale blue or gray cytoplasm with indistinct borders, especially so that they appear in groups or in clusters. Okay, so as you can see, the chromatin, the nucleus is granular. Okay, granular, finely granular chromatin. So that means it is not condensed. So your endocervical cells, they may also be seen in your vaginal smears. Malapit na yan. Okay, and then lastly, we have your basal cells. So these are small, round to slightly oval cells with relatively large nuclei. They are found before puberty and after menopause. Okay. So in addition to the different cells that we can see in your vaginal smears, so another phenomenon that we are able to observe depending upon the predominant hormone that is present in a female or in your female patient is your ferning. Okay, so when we say ferning, so this pertains to the drying of your vaginal or cervical secretions due to the formation of your salt crystals. And again, the hormone that influences your ferning is your estrogen. So in particular, your estrogen promotes ferning. Okay, so when we say ferning, so you would be able to see arborizations, which has been described to have a palm leaf appearance or pattern. Okay, ayan. So I repeat ha, your ferning, this is promoted by your estrogen. In contrast, ferning is inhibited by your progesterone. So say for example, okay, the predominant hormone that is present in the female is estrogen, then you should be able to see ferning. Okay, so if for example, the predominant hormone that is present in your female patient is progesterone, then you should not see ferning. Okay, ayan. Yes. So what are the different criteria that we use for the cytologic diagnosis of your normal pregnancy? So in addition to the evaluation or assessment of hormonal status, we can also use your vaginal smears to detect, okay, normal or abnormal pregnancy. So these are the different criteria, okay, that we use in order for us to know that there is normal pregnancy. Okay, number one, there should be a marked progesterone effect. Why? Because the hormone progesterone, this is the hormone that is needed in order to maintain pregnancy. So in particular, remember from your clinical chemistry 3, your progesterone is the one that is responsible in maintaining the integrity of the vascularization of your endometrium, which is needed to maintain pregnancy. Okay, ayan. And so, dapat ang predominant hormone is progesterone. Okay? Yes, so this is indicated by the absence of burning. Remember that the hormone progesterone inhibits burning. So you should not see burning. Okay? Another, at least 50% of your intermediate cells should be in clusters. So this indicates the predominance of your intermediate cells. Remember that your intermediate cells, they are associated with pregnancy. They are normally, okay, present in pregnancy. Alright, so some typical pregnancy cells are present because again, your pregnancy cells, from the term itself, they are associated with pregnancy. Okay, less than 30% superficial cells. So that means, okay, um, this limits, okay, this indicates a limited amount of estrogen, okay, because katulad nga ng sinabi ko, it's actually your progesterone which should be predominant during pregnancy, okay. And what type of cell indicates the presence of your estrogen? It's your superficial cells. Right? So in particular, your superficial cells will manifest through acidophilic character, which is governed or influenced by the presence of your estrogen. Okay? So dapat less than 30%, okay, of your superficial cells should be present. Right? Another, yes, so the presence of your lactobacilli, particularly your daughter line bacilli. Okay, so your daughter line field, you should be able to see this, yes, in normal pregnancy. So daughter line field, dirty background should be observed also, okay, in cases of normal pregnancy. All right, so those are the different criteria. Now, yes, this is actually our concern because, again, in the laboratory, we usually receive your vaginal smears. Okay, nakasmear na actually yan na nare-receive natin in the laboratory. So our job is to perform fixation, okay, and to perform your pap staining. So again, since this is cytology, so the recommended stain for cytology is your Papanicolaou staining or your pap staining. So these are the different stains that are incorporated in your Papanicolaou staining. But in order for us to understand the procedure that is in your module, that is in your module, okay, let us try to understand the different steps or the different or the schedule of activities for your Papa Nicolau staining. Okay, so prior to using or to dipping your smears into your stains, okay, so remember that the first step is to bring your slides to water. Okay, so that's why please refer to the staining procedure in your module. So you have there 95%, right? And then 70% alcohol. Again, you have to bring your slides to water. Okay, ayan. Because just like what I have mentioned, one of the solvents that is commonly used to prepare your stains is your water. Okay, so that's why there is a need for you to hydrate your smear. Okay, so that it becomes compatible with the stain. Okay, so after bringing slides to water or after hydration, the next thing that you have to perform is to dip it into your Harris hematoxylin. So your Harris hematoxylin, so again, this is a basophilic stain. So that means, okay, that means it will stain basophilic structures. Okay, so in particular, your Harris hematoxylin, this is a primary stain that will stain your nucleus. Okay, as well as the different structures which are found in your nucleus. Okay, yan. So it is the primary stain, it is the nuclear stain, it is the basophilic stain that is incorporated in your Papa Nicolau. Alright, so after your Harris hematoxylin, so since your Harris hematoxylin is oftentimes utilized as part of your regressive stain, so ano ang gagawin natin if this is a regressive stain? So we perform decolorization or differentiation. Okay, so that's why the next important reagent that is incorporated there is your acid alcohol. So what is the purpose of your acid alcohol? It is for decolorization or differentiation, to remove excess Harris hematoxylin. Okay, so after decolorization and differentiation, the next reagent that we're going to use is your ammonia water. So again, what is the purpose of your ammonia water? It is a bluing agent. Okay, yes, it is a bluing agent which enhances your nuclear stain. In this case, it's your Harris hematoxylin. All right. Yes. And then the next thing that you have to do is to bring your smears to alcohol. Okay. So that's why if you are going to look at the concentrations of alcohol which are utilized, we start at 70% and then followed by your 95%. Okay, so this step is referred to as bringing your smears or sections to alcohol. Okay, so you are performing basically a dehydration process. Why? Because the solvent that is utilized to prepare the next two stains is your alcohol. Remember, I discussed also what are the different solvents that we can use in the preparation of your stains. So we can make use of your water, we can make use of your phenol, we can make use of your alcohol, and then I forgot the other one. Okay, yes. Basta dapat naintindihan nyo why we have to perform dehydration. Okay, ayan. Because, again, the solvents that we use for your OG6 and your EA36 or 50, so it is your alcohol. So you have to make your smears compatible with your stain. How do we do that? You bring it to alcohol by performing a dehydration process. So meaning you are going to immerse it in increasing concentrations of alcohol. Okay, so after bringing your smears to alcohol, the next thing that you have to do is to immerse it in your OG6. So OG stands for orange green. Okay, orange green. All right. Ayan. So your orange green, so this is a counter stain for the cytoplasm of your mature superficial cells. All right. So I repeat, it is a counter stain for the cytoplasm of your mature superficial cells. So in particular, okay, in particular, so your orange-green 6 is made up of 0.5 to 1% solution of your orange-green in 95% ethyl alcohol and phosphotungstic acid. Okay, ayan. So this serves as an intensifier or a counter stain. Okay, yes, a counter stain. So please take note ha, it is a differentiator because it is used as a counter stain. Okay, yes, it is considered to be a differentiator because it is used as a counter stain, specifically of your mature superficial cells. All right, so after this, again, you have to immerse it in 95% alcohol before moving on to the next stain, which is your EA36 or EA50. So EA here stands for Eosin Azure. Okay, so EA here in 95% stands for ethyl alcohol. So, but for the third stain, EA stands for Eosin Azure. So your Eosin Azure 50 or 36, so this is utilized as a counter stain for, okay, this is utilized as a counter stain for your immature cells, for the cytoplasm of your immature cells. Such as, what are examples of our immature cells? We have your parabasal and your intermediate cells. Okay, so immature cells such as your parabasal and your immature cells. So the components of your Eosin Azure, so we have your light green SF. Okay, so we have your light green SF. It also contains Bismarck brown. It also contains Eosin Y. Okay, what else? It also contains phosphotungstic acid and lithium carbonate. Okay, so those are the components of your Eosin Azure. Light green SF, Bismarck brown, Eosin Y, phosphotungstic acid, and your lithium carbonate. Okay, so after immersing it here, so you have to immerse it again in your 95% alcohol, and then finally, you have to make use of 2 changes of xylene. All right. So as you can see, one difference between your HNE and your Papa Nicolau staining is that for your HNE, there is a need for you to use 2 changes of xylene at the start, right? So what is the purpose again of the 2 changes of xylene at the start of your HNE? So it is utilized for deparaffinization to remove excess paraffin. But since we are talking about smears in this case, do you have to perform deparaffinization? No, because smears nga eh, they are not sections. They do not come from your paraffin blocks. And so there is no need for you to include silene at the start of your Papa Nicolau staining. Okay, so silene is only utilized at the last part of your Papa Nicolau staining, and the function of which is the same as that of your H&E, which is for clearing purposes and to make your smear compatible with the mountant that you are going to utilize during cover slipping. Okay, so ayan. All right, so those are the different important steps in your Papa Nicolau staining or your PAP staining. Okay? So what are the different advantages of your PAP staining as compared to the other methods or the other staining techniques that we use in exfoliative cytology? So number one, it renders a transparent blue stain of the cytoplasm. So that means, okay, you are able to see cells even if they are superimposing, even if they are on top of one another because of the transparent blue staining of the cytoplasm. Okay, so it allows overlap cells to be identified. Okay, so apart from that, with the use of your Harris hematoxylin, which I have discussed to have, which I have described rather to have a very powerful nuclear staining characteristic, so you are able to produce excellent nuclear details. Okay, so the color range is predictable and of great value, particularly in the identification and classification of your cells. So kindly refer to your module for the different expected results of your PAP stain. Okay, and then lastly, it is valuable in comparing cellular appearances in your smears. Okay, ayan, particularly because we are also able, or the advantages rather of your PAP stain, it is also attributable to, or attributed rather to the two counter stains which are incorporated. Yan. So that's why we are able to classify which one is mature, which one is immature. Okay, yes, ayan. So those are the different advantages of your PAP stain. So in addition to your Papa Nicolau staining, so there are other methods that we can use in order for us, okay, to examine, okay, or to create optical differentiation and to be able to classify, okay, your normal cells from your abnormal cells. All right, so one is your acridine orange. Okay, however, take note that for your acridine orange, so this involves the use of a special type of microscope, which is your fluorescence microscope. Okay, yes. So your acridine orange, this is a nuclear, or this is a stain for your nucleic acids. Particularly, we have your RNA and your DNA. Okay, so your RNA, so it, yes, so it is, or it emits a brick to orange red fluorescence. And then for your DNA, it emits a green and yellow fluorescence. All right. So depending upon the degree or the color of fluorescence that is emitted, we are able to determine what specific nucleic acid is predominant in our sample. So if, for example, your RNA is predominant, so this is seen as an increase in basophilia. Okay, so increase in basophilia signifies normal growth. Okay, so it signifies normal growth. So under the microscope, you should be able to see a break to orange-red fluorescence. That is the one that, yes, that is predominant. So I repeat, in normal growth, the predominant fluorescence that should be seen is your brick to orange-red. So in contrast, okay, increased acidophilia which means that there is a predominance of your green and yellow color. So this signifies abnormal proliferation seen in malignancy. Okay, so increased acidophilia. So anong color ang predominant? Green and yellow. So this indicates or signifies malignancy. Increased basophilia. What are the predominant colors? We have brick to orange red. So this signifies growth. Okay, normal growth. So apart from your acridine orange, we can also make use of your phase contrast microscope. So this is the second best choice after your pap staining, and it is utilized for hormonal evaluation of gynecologic specimens and for cancer detection. Okay, and then lastly, we have your interference microscope. So your interference microscope, this is based on the dry weight of your cells and your cellular constituents. Okay, so take note that your cancer cells, okay, have a less weight, dry weight as compared to your normal cells. Okay, because of course you expect to see less of your structures in your cancer cells. Ayan, because remember the different structures which are present in your cancer cells, they actually undergo disintegration and dissolution. Thus, their dry weight is less than that of your normal cells. Okay? So actually, that's the end of our discussion for exfoliative cytology. Okay, so I'll see you again in the next videos that I will be giving. Okay, so thank you so much for listening. Okay, bye.